Welcome back. Well, one of the biggest problems we're facing at the moment in our society is making sure everyone gets enough food. Food prices are now so high, food price inflation so high, that many people are battling to get enough food for themselves and for their children. Today is World Hunger Day. Dr. Chantell Witten is a researcher at the University of the Western Cape at their Centre for Excellence for Food Security. Dr. Witten, good afternoon to you, and thank you very much indeed for your time. We know the price of food has risen so dramatically. Is that leading to more hunger, more people just not getting enough food to eat?
Good afternoon, Stephen, and good afternoon to the listeners. Absolutely, with the rising unemployment, the prices of food going up, it's really making hard for people to put food onto the table, and the most vulnerable are children.
It's not just the price, is it? I mean, it's so difficult to feed a family. So potatoes are so much more expensive than they used to be, and the cost of the electricity to cook them, if you can get it, that's so much more expensive as well.
Absolutely, and this is exacerbated not only just the price of food, but it's also the fact that many households have to keep down more than one job to make ends meet. So moms don't actually have the time to do the cooking, to do the preparation, and to actually feed meals. So they are reverting to quick, convenient foods, which are not the most nutritious.
So people, instead of cooking potatoes, for example, they are using noodles instead, which don't have the same impact. Children need more than that.
Absolutely, Stephen, and this is what we talk about. Hunger is a feeling of hunger. You know, the belly is not full, but we also talk about micronutrient hunger. That's when the food is deficient in the nutrients that are needed for children to grow. And as you know, South Africa has a problem with childhood stunting. That's an indication of chronic hunger over time. That means our food is not nutritious enough to actually support children's growth and development, and that affects brain development as well.
The thing about stunting, I mean, it amazes me, it scares me how so many children actually don't get enough food. Why as a society over so many years have we found it so difficult to deal with that? We have a child support grant, we have a school nutrition program, and yet levels of childhood stunting are still very high.
Our levels of stunting haven't changed in the last 20 years, and this is not just an academic exercise. It's actually to, I want to say, spur on government to do more. The child support grant is less than what a basic basket of food costs. The nutrition program only supplies children with less than 30% of what they actually need. So we are relying on households to provide the other 70% when the households are unemployed and also depending on, social assistance. So while government has very big programs, and these programs are making a contribution, if it wasn't there, it would be much, much worse. So it's I want to say piecemeal. It's not enough to get our children out of the state of stunting, and that's why it's been standing still for the last 20 years. We need to do more. We need to dig deeper. And here I think we need to be calling on private sector to be doing more. We need subsidized foods if we're going to make any difference to children's diets.
Would subsidized foods be better than providing a bigger income grant or a bigger child support grant? And unfortunately, history is full of examples of what happens when some things are subsidized and some things are not. You can have perverse outcomes. But are you suggesting we need to really completely change the way we manage this?
I think we should be looking at other countries like Brazil, Malaysia, Indonesia. These countries have all reduced their stunting levels, and they did it by actually subsidizing foods that were directly going to children. So for my understanding, even if we made the grants bigger, there are more people in the household that are unemployed. So you have no control of what's actually going to the child. But if you were subsidizing foods that were going to early childhood development centers, if you were subsidizing foods that were going to children as food packages to children in schools, and I'm not talking just about the national school feeding program, but actually giving children food relief that every child receives, takes the package back home. That way you can make a big difference, and that's what other countries have done. And we as South Africa should be learning from those examples.
We need to talk a little bit about vegetables. You made the point earlier about micronutrients, and it's such an important point. But some vegetables have just gone up by 50% in the last year. Now, this is going to be having a dramatic impact. Are we even already able to see the impact this is having on children, even though it's just been a year? But, I mean, vegetables, as we all know, are so important.
The problem, Stephen, is that already the diet was poor in fruits and vegetables. The World Health Organization recommends that each individual should be eating up to 400 grams of fruits and vegetables. And as a society, we will only get to close to about 180. So that was less than 50%. Currently, our children don't get the vegetables because, like I said, preparation time, besides the cost, it's also about preparation. Mothers just don't have enough time to peel, to make the food, to serve the food, to actually make sure children are having these meals. So our children are relying on very quick, convenient, ultra-processed foods. And that's also exacerbating the micronutrient deficiencies that we are seeing. The other thing is that our population hasn't really cottoned on to doing home gardening. So if every household could do some sort of home gardening, it would make a big influence or big difference to child nutrition. Even just getting a child to eat 1 or 2 vegetables a day would be a huge increase from where we are right now. Children are eating vegetables only on a Sunday because that's when parents are home.
Sure. There needs to be a, I wonder sometimes if we just don't realize how serious all of this is, that we need a proper national effort, that wherever you go, someone needs to be giving you seeds to grow vegetables, to grow your own vegetables in your back garden if you can. Communal gardens, groups of people doing this together. I mean, all of that, would that make a big difference?
Absolutely, and we saw that working during the COVID, the 2 years of COVID. We saw communities come together doing community gardens. We saw the community action networks that were, forming organically and forming sporadically across the country, and we know that made a huge difference to children's intake. But we're not seeing that energy multiply and scale up to the levels that we needed to scale up. And of course, we can't do this just relying on civil society, because civil society is also very, very stretched. We really do need government to step in. We really need the Department of Social Development. We need rural and agricultural department to step in to support these efforts. Otherwise, we are just doing more piecemeal, and our stunting levels are never going to go down.
You would think that government would take this incredibly seriously. And I mean, through the school nutrition program, we know that they do. But even in KwaZulu-Natal and in the Eastern Cape, 2 of the big provinces in this country, we've had problems there. Are you worried that we might actually, if we've had problems there already, have bigger problems with the school nutrition scheme? I mean, that would be a national catastrophe if we did.
It is a national catastrophe, and it has been a national catastrophe because we had to take, when I say we, I mean civil society had to take government to court so that they could reinstitute the school feeding program because it was so needed during COVID. And we haven't really held government accountable for what they should be delivering at schools. The school program is nutritionally adequately worked out as a menu on a piece of paper, but what's being served at schools is nowhere near what should be served to children. And so we need accountability, and we need civil society to actually do the audits. Equal education was given the mandate by the High Court to make sure that the foods were actually in line with what had to be served. And so we haven't had a report. It's been more than a year. And I think civil society should be reporting back to say, have things improved or not improved? And we also know that funding cuts are coming down the way because of austerity measures, and it's going to affect the school feeding program.
Dr. Chantell Witten, thank you. Researcher at the University of the Western Cape, their Centre of Excellence for Food Security. Really appreciate the time.